If your patient has a recent long bone fracture, especially a femur fracture, and then suddenly starts having trouble breathing, I want you to think about fat embolism syndrome immediately. The NCLEX loves to test this condition because it has a very classic presentation. And the three big findings that you need to know are respiratory distress, altered mental status, and a petechial rash. Now, the respiratory distress, it can look like low oxygen saturations, shortness of breath, tachypnea, and hypoxia. For the altered mental status, I want you to think confusion, restlessness, agitation, anxiety, drowsiness, or a decreased level of consciousness. And the petechial rash, it usually shows up as these tiny red spots on the chest, neck, shoulders, armpits, or around the eyes. One of the biggest clues is the timing. Fat embolism syndrome usually develops 24 to 72 hours after the injury, not immediately after the fracture occurs. The highest risk patients are those with femur fractures, pelvic fractures, or multiple long bone fractures. So the downside is there is no specific cure for fat embolism syndrome. Treatment is mainly supportive care while the body clears the fat droplets on its own. That means you're going to be providing oxygen, monitoring oxygen saturation closely, assessing their respiratory status, performing frequent neuro checks, and supporting the patient if respiratory failure develops. If you get this on the NCLEX and it talks about treatment, don't go looking for a specific antidote or medication. You want to think supportive care and oxygenation. So if the question is a patient with a recent femur fracture and they're becoming hypoxic, restless, confused, and they develop that petechial rash, always think fat embolism syndrome. It's not a pulmonary embolism and it's not pneumonia. Fat embolism syndrome. If the question talks about a patient that had a long bone fracture and that combination, I want you to immediately think fat embolism syndrome every single time.